A very good morning to one and all. Today's topic is on provisional restoration. Coming to the provisional restoration, which is nothing but actually it is a interim or transitional or provisional restoration. It is also called interim or provisional, which is nothing but we will be doing the restoration only for we will be doing the restoration only for the particular amount of time before until the definitive process submit. That is called the provisional restoration. Next, coming to the classification. According to GPT definition, a fixed it is a provisional restoration, which is nothing but a fixed or removable dental processes or maxillofacial processes, which is designed to enhance aesthetic stabilization or functional for a limited period of time, after which it is to be replaced by a definitive dental or maxillofacial process. As I have already told you, provisional restoration is nothing but the replacement of processes within the particular only for a limited period of time until the definitive processes are made. Coming to the requirements, there are 3 types of requirements mainly: biological, mechanical, and aesthetics. Coming to the biological, basically why we are replacing the restoration means provisional restoration means for protecting the pulp, that is pulp protection, protect the periodontium for good marginal fit and occlusal stability, and to maintain the tooth positions. Pulp protection, which is nothing but after preparing the tooth, there will be at least 1 or 2 weeks meanwhile gap. There will be a gap for placing the definitive process. In meanwhile time, if the more force is given on the tooth which is prepared, then there might be the sensitivity might be seen in the restoration because of more force, and there might be there might be any because of course there might be any because of more force towards the pulp region, there might be irritation towards the pulp. So for protecting the pulp before the definitive processes are placed, we have to make sure that provisional restorations are done. Next, coming to the protecting the periodontium, which is nothing but near towards the in this picture, like similar to that, towards the gingiva and towards teeth, because of more force and as well as the meanwhile duration for good marginal width, we have to protect the periodontium, so that to maintain the sometimes if you are leaving the long gap means gingiva might be going towards the over the tooth patient or something. So that for that we have to protect the periodontium. Next, for occlusal stability, as well as we have to maintain the to prevent the supra eruption of the teeth, and as well as the mesial drift or the distal drift between the meanwhile replacing the definitive processes. If you are not replacing with the provisional restoration means occlusal stability will not be there. So that to prevent supra eruption and to maintain the stability towards occlusal surfaces level plane, we have to do the provisional restoration. And coming to maintain the as I already told you, you have to maintain the supra eruption as well as the mesial and the distal drift, as well as the fracture towards the during the more chewing of the teeth, there might be any fracture. There will be more fracture that might be cause of the fracture in the teeth, as well as the tooth can be drifted towards the position. So that provisional restoration is needed. It's coming to the mechanical, mainly to protect the underlying teeth, as for adequate strength, that is for thick connector, as well as the adequate tensions. Coming to the, as I have already told you, another requirements are aesthetics, which is nothing but replicating the shape of the teeth and proper shade matching. And mainly to protect the underlying teeth means, which is nothing but if we are not replacing with provisional restoration means, because of more force, the flexural strength, flexural, because of more force, the teeth can be damaged. That is because of biological. Mechanical means because of more force, the teeth can be damaged. So that the provisional restoration should also maintain the adequate strength should be there for that, as well as to prevent the displacement of the teeth. That material should be the adequate strength, because to prevent displacement of the teeth as well as the retention purpose. Aesthetical means, if some patients are want to replace the anterior teeth means, for that patient we have to patient will not be pleasable to leave the clinic before without replacing the teeth. So for that purposes, provisional restoration can be given for proper shade matching. With the proper shade matching, as well as patient will be placed with the aesthetics according to the size, so that it can be replaced with the provisional restoration. These are the next. Coming to the material requirements are convenient handling. It should be, material should be biocompatible. It should be dimensional stability and easy to trim and repair. Because material we will be after provisional restorations are replaced, we have to replace with the definitive processes after for 2 or 3 weeks after the particular period of time. So for that, the provisional restoration which we have replaced, it has to be removed and replaced with the definitive process. So for that purposes, it should be convenient handling, and it should be easy to trim and repair, as well as if there is any fracture in the provisional restoration means, for that also we have to for that at the time also we can adjust with the whatever provisional restoration which we have placed already, within that itself we can adjust and trim. Next, coming to the classifications based on the method of fabrication, it is prefabricated and custom made. Prefabricated means according to the normal sizes and normal size and width, they have many companies have prefabricated previously. So if the ready-made crowns will be available prefabricated for provisional restoration. For children's stainless steel crown also will be there. We have to slightly adjust it according to our size, and we have to cement. For custom made means, we have to make it according to our tooth structures. That is what custom made, which we do. We are doing the provisional restoration means, that is called custom made. Next, coming according to the classification, according to the material are acrylic resin, metals, that is the stainless steel, cellulose, and polycarbonate. These are the type of material which is used for fabrication of provisional restoration. Next, according to the method of fabrications, external surfaces form are there, tissue surface forms are there. If external surfaces form should restore the external contour of the natural teeth. Tissue surfaces should follow the contour of the prepared teeth. That is the two surface forms of the method according to the method of fabrication. According to the external surfaces form, which is that is what we have already told you, prefabricated. According to the prefabricated material types of polycarbonate metal crowns, that is aluminum or tin silver oxide. You can, as you are seeing in this picture, these are the ready-made crowns will be available. We have to slightly adjust it, and we have to make sure that just it is attached to the teeth with the help of the cement. Then next, coming to the custom made means, for making the custom tray, what we custom made provisional restoration is, what we have to do is, first of all, we before preparing the tooth, we have to make the diagnostic cast with the help of the alternate impression. And then after pouring the cast, we have to take the putty, that is elastomeric impression material. With the help of elastomeric impression material, should be placed over the natural teeth, and you have to mimic the take the mold of the natural teeth, which is before to preparing the tooth, which is to be done before preparing the tooth. One type of for making the custom made, we can take the impression of the before preparing the tooth, can take the impression of the natural teeth with the help of either elastomeric impression material or using the vacuum form sheets that is adapted over the diagnostic. There are two types of methods are there. This is how it should be done. In first picture, before the toothbrushes are made. In second picture, you can see that that is the silicone elastomeric putty impression we made, placed over the natural teeth, and according to their size and shape, they have cut it and trimmed it and taken the impression mold. That mold will be replicated. And after the deficits of fractured teeth means in the diagnostic impression in which we have made, with the help of the putty index, you can make the crown in the diagnostic cast. You can do the wax pattern in the diagnostic cast, and then this is one another method. After the fractured teeth, you will be making the wax pattern over the diagnostic cast, and then over that diagnostic cast, you will be taking the putty impression, and then you will be making the provisional restoration. In this way, we can do the another method, that is provisional restoration. According to the tissue surface form, this is direct method and indirect method are there. And direct, indirect method, which is direct method means which is nothing but we will be making the temporary restorations directly in the mouth. We will be placing, after preparing the teeth, we will be direct, as I said before, we have taken the putty impression means we can make, we can place the material over the prepared tooth surface, and just we have to place the putty over, we can take the material placed over the putty impression, which we have taken the mold, and then we have to place the putty index along with the material over the prepared teeth. That is called direct technique, which is nothing but directly we will be preparing the restoration in the patient's mouth. Indirect technique means we will be, as I told you before, we will be making the wax pattern, and we will be making the already putty index will be taken. Over that, the prepared tooth cast should be taken, and then over that we have to same along with the material and putty index, you can adapt it to towards the cast, and we can make it and trim it and place it in the, that which is nothing but direct means which is nothing but we will be making the provisional restoration in the mouth. Indirect technique means which is nothing but we will be making the provisional restoration in the lab, and then we will be placing it, submitting in the patient's mouth. That is how. Direct, indirect technique means that is how we will be making and then putty impression, and then both indirect technique we'll be doing in the lab, and then again we'll be, that is how it is done. This is the video. I could not show the video. I will show somehow. This is one of the video which for direct method. Actually, we will be mixing the putty. You can observe this video. We'll be mixing the. And you will be placing it in the patient spot. This is how we have to do the provisional restorations. This is from. And then in that putty index, which we have to place the material. What teeth which you have needed, will be cutting it. This is how putty index are made. Here, Vaseline will be applied over direct application. This is how putty index are. Here you can see in this video, material which we are using, we have to place it over the putty index, and then we have to place it directly over the teeth. This is how the restorations are made, direct provisional restorations are made. And then after it gets it, if you the index, it will be already prepared, and then you have to just trim it and adjust it and make the you have to just trim it and adjust it and place it in the patient's mouth. That is how the provisional restoration direct methods are used. The excess has been removed and adjusted. After it gets it, it will be placed in the patient's mouth. Polishing can be also done after the set. You can see here, it can be removed after it gets it, and then you can polish it, and then you have to trim it and adjust it, and you have to trim the excess area and then polish it, and then you can cement it using this material. This is the indirect technique which I have already told you. This is one of the method. This is like vacuum sheet which should be placed. With the help of vacuum, you have to make the like similar to putty index. We have to make the index with the help of using vacuum sheet. This is how vacuum sheet has mold. Index has to be taken with the help of vacuum sheet. In that, over that, you can place the impression material over that index, and then you can directly place it in the crown which you have placed over the teeth. You can see here. Indirect method is the preparation tentatively in the cast, and then over that which you have already made the template. Here, tentatively prepared in the cast before patients are coming, the Vaseline applied, and then what you will be doing is over that you will be mixing the material and placed over the template, and the similar to the putty index, you have to make it and place it in the vacuum place template, and you have to place it in the cast over the prepared area. So that this is how the temporary restorations are made in the indirect method. As we have already seen in the videos, this is how the direct technique and indirect technique, which I have already told you, I have shown in this video. Direct technique, which is nothing but external surface form filled with the temporary material, which is placed directly over the prepared teeth. This is how I already told you, it will be placed in the patient's mouth directly with the help of putty index. And advantages, time saving. Next is disadvantages are restoration locked. Sometimes it will be locked in the undercut, so that pulp irritation due to temperature rise and restoration. That both are the disadvantages. Next, coming to the indirect technique, just nothing but external surface form filled with the temporary material which is placed over the cast obtained from the patient after the preparation. This is how indirect technique out. This I have already shown in the video, and I have also explained. The advantages of this material are better accuracy and fit. Next, coming to the direct indirect technique, which is nothing but we have to what we have to do is, before patient is coming for appointment, we have to the cast which we have taken for diagnostic impression to alginate. In that diagnostic cast, we have to prepare the teeth. That is, tentatively we have to mock preparation to be done in the teeth, and then which we have already taken either the putty index or the vacuum form sheet shell vacuum form sheet. With the help of that, we have to after preparing the tooth in the cast, we have to place the material over the either putty index or the in the shell, and then we have to attach it in towards the prepared area. So in the cast, which is nothing but so that is how we have to, this also I have already, we will be adjusting it and trim it, and then we have to place it directly in the patient's mouth after placing, after making the tooth preparations. At that time, patient's mouth, we have to adjust the small corrections excess will be there. We have to trim the area and polish it, and then paste it with the help of the cement. That is, shell is relined using resin by placing it directly over the patient's mouth after same thing which I have explained earlier. Next, restoration do not lock in the undercut, reduce chair side time. It will be. Next is minimal resin volume, reduces the temperature risk. And the materials used for prefabricated material used are polycarbonate, stainless steel, and aluminum. And custom made methyl acrylate resin, urethane dimethyl acrylate, and bis acrylic resin. And the material used for cement are most probably zinc polycarboxate or zinc oxide eugenol will be used most probably for temporary purposes. Materials which you have used should be biocompatible, and wear resistant should be there, as well as it should be aesthetical. It should be acceptable working time should be there, and all these materials should be it should not be irritated to the pulp or tissues. This is how it should be done with help of it. So in the same way, I have already provisional restoration within the definitive process also. If it is of in the anterior teeth means, particularly shade is very, very important. If it is of posterior means, then according to that it differs. So for cementing the provisional restoration, I have already told you zinc oxide eugenol impression material or either polycarboxylate can also be used. And nowadays this bis acrylic phosphate and bis acrylic resin, these material resins also can be used with the for provisional restoration. For cements are used as zinc oxide. The limitations of provisional restorations are, it might be lack of, sometimes it might be lack of adequate strength and inadequate margin adaptation will be there, poor aesthetics in long-term provisional restoration, plaque accumulation will be there, and compromised bonding characteristic also will be there, and mild and moderate tissue rotation also will be there in the provisional restoration. And finally, after trimming should be done properly, and you have to check for the fitness, and then you have to cement with the help of the cement, that is either zinc oxide eugenol or reinforced cement on eugenol zinc oxide eugenol cement. And then as these are the common things which is needed for provisional restoration. Now we are going to recall the provisional restorations. If they are asking the assignments, this is one of the important questions. We have to write the definitions first of all. According to the GPT, this is for temporary material. This is before the definitive processes. This is the short time restoration process. The definition we have to write it, and then requirements, that is biological, mechanical, and aesthetical requirements. We have to write about the pulp protection, stability, and irritations. Those things we have to write it. Mechanically also adequate strength, adequate retention for preventing the displacement of the ground. What are the things we have to do, and for aesthetical purposes. And then coming to the material classification of materials, prefabricated and this custom made are there. And after that, then take according to techniques. Direct technique, indirect technique, and direct indirect technique. Direct technique means which is directly made, provisional restorations are directly made over the, directly made in the intraoral, in the oral cavity, directly in the patient's mouth. Indirect technique means you will be, before patients are coming, you will be making the, indirectly you will be making the temporary crown in the cast, diagnostic cast, and then you will be adjusting it and cementing it in the patient's mouth. Direct indirect technique means before you will be adjusting the, we have to take the diagnostic impression, and then in that cast itself we will be making it, and then remove it, and then the pulp of putty index over the prepared cast which you are making tentatively, you have to make it, and then make it, you have to take the putty index in that, over that material should be loaded, or either shell also will be done over the material, and then you have to make the provisional restorations, which is by placing it over the diagnostic cast, and then you have to remove it, and then trim it, adjust the border, and make the do the polishing, and then you have to check for the fit, adjust it in the patient's mouth, adjust it, and cement it with the help of either zinc oxide retinol or either non-retinol. This is how the provisional restorations are made, and materials used are prefabricated and custom made. These are the materials. Thank you. Provisional restoration is one of the important question for 5 marks, as well as mostly commonly asked it, as well as for doing the lab work. Thank you so much.